Good morning again, everyone. We're here at the dental offices of Dr. Norman Bryan and Dr. Anjana Gupta talking dental medicine. And we're going to be focusing today on snoring and sleep apnea with Dr. Bryan. But we want to talk to Dr. Gupta first about what's coming up in the coming weeks. Dr. Gupta, you've got some special things planned, don't you?
I sure do, Craig. In the next couple weeks, I'm going to really try to focus on cosmetic dentistry. That seems to be the big rage right now. Everybody wants that brighter, whiter, better smile. But of course, we're going to go back and reiterate some of the things that we've talked about before, such as overall health and overall good oral health that ultimately leads to that bright, white, nice smile. So,
good-looking teeth and wellness go together.
That's right.
All right, looking forward to that.
Thanks, Craig.
Thank you, Dr. Gupta. Very important, obviously, to look good, but to feel well, and wellness is a big part of what we do here on Fresh. It's a very important segment, and this guy here, Dr. Norman Bryan, is really committed to wellness. And Dr. Bryan, it goes well beyond just what people think when they go to the dentist. For you, it's total well-being, isn't it?
Well, that's our goal. We look at the entire person. We want to make sure that obviously that they have a nice smile, like Anjana said, and also that their dental health is at the optimum. But good dental health also means good oral health. Good oral health means that are we looking at all the parameters for their overall well-being? As you know, we've talked a lot about TMJ, headaches, neck and facial pain, which is kind of our expertise around here. Appliance therapies to make that all happen, make people feel better. Is where we feel like we really excel. So again, one of the things that we look at, we talked about before, was snoring and sleep apnea. Those are areas that we've made some great strides in lately with not only diagnosis of those issues, but also with the appliance therapies that we're able to provide that makes it much more comfortable for people to stop snoring and even improve their sleep apnea significantly.
Well, snoring can be aggravating. I mean, not only to the person who's doing the snoring, but obviously to family members and others who hear the noise going on. But it is a very important issue to take a look at here. And doctor, there is a very simple formula to determine whether or not your snoring is a significant problem, and you've got a simple little test that people at home can even take right now, can't they?
Well, we do. It's simplicity is important. Yeah. It's called STOP, and there's 4 parameters that people can realize right away whether they need to be, if this is a problem for them. STOP is an acronym for, first of all, do you snore? Second of all, are you tired? Are you sleepy during the day? Are you not getting a good rest at night? And then, has anyone observed you stop breathing, gasping for breath at night? Has that been an issue? And lastly, blood pressure. Have you seen increases in your blood pressure? Are you under medication for that? So those 4 issues, if you have 2 of the 4, that means that it's important that you test this out. Make sure that there isn't something going on here. It's easy to get a pill for their blood pressure, to take stimulants during the day if you're sleepy. But think about what you're doing here, and is there a reason for that? Is there some way that we can stop that process to keep you away from those medications, which are not ultimately the best for you?
Well, if you have 2 of those 4, you could be a candidate to come see Dr. Bryan. And doctor, there is a device that you're now giving patients to take home with them that will actually help to measure some of these things that go on during a person's sleep at night. I think it's remarkable what you're doing here, working really close with doctors, aren't you?
Oh, indeed. The miniaturization that we have today, fortunately, has allowed us to use a very small device like this one that actually is strapped to the patient at night, where they can take a test for sleep apnea in their own bed. It used to be that the only way of doing this was going to the hospital, going through a sleep study, and of course, that's one thing that people want to avoid. They don't want to sleep in a foreign bed. They don't want to go to the hospital. And the cost is prohibitive. So now we have a very objective way of doing this in their own bed where we can take some very simple screening here to determine whether or not they have a problem. Now, that problem may be something that it will allow the insurance company to cover their appliance therapy or their CPAP if necessary. It may warn us that there's something more involved, that maybe a hospital study is more necessary. But at least we have a way of determining at this point whether they indeed have a problem, and that, is this something that we can solve, like I say, with our appliance therapy. So we now can provide this. The information for this is stored overnight. They get 6 hours of sleep with this device. Then we send the information to a pulmonologist who goes over the data, determines the diagnosis, and therefore we can determine from that whether we can get coverage for the insurance company, or whether possibly, even if the appliance is working well, take a second study and determine that.
This is cutting edge stuff, Doctor. Tell us, it's got to be more accurate, or at least potentially more accurate, knowing that you're probably getting a more restful sleep at home than if you were taking a sleep study maybe somewhere else in a foreign environment.
Well, exactly. No one likes to sleep in a hospital. No one likes to sleep in a foreign bed. You're much more comfortable at home. So we're going to get really much more accurate results as far as, are you sleeping well, what's happening. Now, this basically measures respiration, measures the amount of snoring that you do, and it also measures the amount of blood saturation, the oxygen saturation in your bloodstream. So it tells us if we're getting a drop in that oxygenation because you're not breathing well at night. And that's kind of the whole key behind sleep apnea.
Yep.
Not breathing well, having your heart work harder, lack of oxygen to your brain, of course. Those are things that we have to be aware of. For example, Alzheimer's. You have a 50% greater chance of having Alzheimer's if you're sleep apneic.
That's a huge percentage.
It certainly is. And that's why when we see people in denial here, they may say, well, my wife says I snore, but it's not a big deal. Well, it is a big deal. It can be a big deal, especially if we see these heart situations happening. And if you're gasping for breath, we know it's important to look into this further.
In terms of wellness, and it's been said many times that little steps can make a big, big difference. And when we talk about that simple little step of first determining whether or not you might be a candidate, and then looking at the simple instrument here, very small, I'm sure very effective, but small. And then one final step, and that would be if a person does have a problem, there is a device that you can provide that person right here from your office, Doctor. And it's a very interesting device that has a lot of different possibilities, huh?
This is the one I think is the most conservative, and the one that I personally wear.
Not on TV, though.
No. At night. But this appliance will go a long way to stop the apnea. It keeps the tongue forward, keeps the jaw forward at night, so we don't get that collapse back here in the back of the throat. And that's where 95% of the obstructive sleep apnea comes from. So it's a nice way of a nice technique to allow people to sleep well, comfortably, without the problems of having to wear a CPAP, which is basically a type of respirator.
It's like a kind of a tent, isn't it, in a way?
Indeed. Yes, it is.
I like sleeping in tents, but not that kind. Well, Doctor, thank you very much. A great segment here today talking about what you can do at home, simple steps again. If you maybe are experiencing some of those things we talked about, snoring, sleep apnea, or maybe know someone who is, it could literally be life-saving treatment here at the offices of Dr. Bryan and Dr. Gupta. Dr. Bryan, thank you again.
Thank you, Craig. Appreciate it.
And again, if you'd like more information, go to myfresh.tv, and it's there that you'll find a link to the office, the dental medicine office of Dr. Norman Bryan and Dr. Anjana Gupta. We'll be back in just a moment, so stay tuned.